Hi everybody, my name is Lindsey, Nurse Lindsey, and this week I'd like to talk to you guys about a POLST, or in Massachusetts, as we self-label it, a MOLST. And what does that stand for? Patient Order for Life-Sustaining Treatment. And this POLST was designed as a paradigm in Oregon. What's a paradigm? A paradigm is a fancy word for a set of standards or methods. And this was created, I don't exactly know when, but if you want, I will get back to you on that, to create conversations between patients and families and physicians about end of life decisions and a patient's goals and how they could create a treatment plan that fell in line with their values, their beliefs, and their goals. So this form is usually for people with a serious disease or people who are frail and elderly. And it is a medical order, so it's usually filled out with your physician, or your nurse practitioner, your physician assistant, your primary caregiver of some sort. It can be assisted with you by a nurse or a social worker. And if you're not filling it out for yourself as a proxy, which we talked about in my first vlog, you're going to come across this at some point. So this form right here, which is 2 pages. The second page tends to be a doozy for some people, so I'm going to go over this pretty briefly for you guys, and I want to explain to it as easy as I can to you what this entails. And if this looks familiar but slightly different, it's because it can be typically pink. That's usually the form color that they'll fill out in your doctor's office. So the first part, A, includes cardiopulmonary resuscitation. That is, do you want chest compressions? It could also mean, do you want a chemical code? You can choose to have medication given, but not compressions. So this is yes or no. Do you want compressions? And I want to be very clear with you guys. It's not called hugging. It's called life-saving. So it's aggressive compressions, fast. If you want a little fun fact, the perfect rate of CPR goes down to staying alive. That's fun. Like the right rate to ratio and time frame should go to staying alive. I just have always remembered that, so I give good CPR. The second part is ventilation, and that is 4 options. Do you want to intubate and ventilate, or do you not want to intubate and ventilate? And that's a breathing tube. So that's a tube that goes in your airway to either assist you or breathe for you. So it's doing the work, it's mechanical. And the part below it says, do not use invasive ventilation or use non-invasive ventilation. That's CPAP. So some people use CPAP because they have sleep apnea. I personally don't think CPAP is a bad idea. Sometimes if you have a pulmonary disease or a heart condition or some type of thing where you retain fluid, this is a way to create positive pressure, to create oxygen flow through your blood better, to help support your lung and brain functions and heart functions. So it doesn't necessarily prolong anything, but it does kind of, for some people, create comfort. For some people, they do not like the mask or the noise and they feel very overwhelmed by it. So like I said, this is something you talk about with your doctor. The third part C, I have a hair on my face. Sorry, guys. This is, to me, the most important part. And this is transfer to hospital. Don't transfer to hospital. And if you're at home and you have private care physicians and nursing and hospice and home care, you're not necessarily going to want to go to the hospital and run through all of that run amok. They're not known for their food or hospitality. So if you know for certain that you want to remain in your home, fill this out. You should have this filled out and it should be on your refrigerator, because if an emergency happens and a paramedic were to arrive in your home, they're going to bring you to the hospital unless they see this posted. They don't know your medical records, but if they see this form on your refrigerator or posted by your doorway, they are going to keep you in your home and care for you there. The next one, who's signing this? Is it you or the proxy? Is this a guardian or a parent? Like I said, choose your proxies wisely because they can make decisions for you and redo this. So it's really important that if you're filling this out and you do have a healthcare proxy, they know you filled this out, they know where it is, and they know what your wishes are. That's what I talked about in my first vlog. You can watch it if you'd like. The second page, this is the one that really gets people. It's a lot of information when you're in a crisis and things are going all over. So I want to discuss this really briefly with you guys. The first part, intubation and ventilation, refer to section B. We already talked about that, so we're covered there. Dialysis. Do you want to go dialysis? Do you not want to go for dialysis? Patients who are on dialysis probably already know this decision. If you don't know what dialysis is, it's a way to filter chemicals and waste out of your body that your kidneys are no longer able to excrete on its own. So there are two forms of patients that end up on dialysis, acute and chronic. Some are for a short term, some are for a long term. So this is something that you really want to think about. Dialysis isn't like going for a picnic 3 times a week or twice a week. It is a life change, and it is a change in your quality of life. So you really want to talk to your doctor about what is dialysis and how would you exactly want to be treated with it. You can also choose to do it short term. And all of these things in the bottom have the option to wait, that you're undecided, you didn't discuss it, or you would like to have it, but for a short period of time. And you can specify the amount of time, which is perfectly fine. But the next part is artificial nutrition. So that's, would you like something such as a feeding tube? It could be in your nose, in your mouth. It could be an arm parenteral nutrition, or it could be through your stomach. It could be any type of artificial nutrition. So it's important that if you know that this is something you do or don't want, or it's with or against your religious preferences, that you discuss this. My personal belief, which is just my personal belief from hospice and end of life care, is that starvation is not a painful thing to experience. You're not running marathons and you're not exercising when you're in bed and you're getting pain medicine and care and you're, hopefully surrounded by your loved ones. So eating isn't necessary, and we always tell you not to force feed somebody if they can't eat. So usually somebody can be maintained with, mouth swabs and oral care. So this is something you really got to talk to with your proxy about. And the very last part is hydration, IV fluids. If you have heart failure or a pulmonary disease, or you're prone to fluid retention and you have problems with gaining fluid or swelling, this may not be something that you would be comfortable with. It may just exacerbate symptoms that you already experience when you have too much fluid on board. So this last 3 parts as a patient may be easier to understand than a family member or proxy. So I really urge everybody to go to my website, which I'll post right here, and read the blog and listen to the video about the proxy. You can also find it on my Facebook and Twitter, Nurse Lindsey, and have conversations with your proxy. Be an educated person and an advocate for yourself, because who else is going to advocate for you if you and your loved ones don't? Hopefully you get a nurse like me, and I will fight for you and get you everything you deserve and want and more. But it's important to have these discussions and decisions made. And if you have something you want to know about, like immunizations or veterans benefits or things that are available to you, please send me a message at nurselindsey30@gmail.com, and I will answer your questions or post a blog about it. I hope everybody has a good day and a great holiday season. Thank you so much.